Most women don't know they have ovarian cancer until it's too late. Why? Because the symptoms feel so normal, like bloating, feeling tired, or needing to pee more often. But those everyday signs could be hiding something deadly. As for how common ovarian cancer is, around 1 in 91 women will be diagnosed with ovarian cancer in their lifetime. It is more common in older women, with about half of cases occurring in women aged 63 or older. While ovarian cancer is more frequently seen in older women, certain types like germ cell tumors and low-grade serous carcinoma are more likely to affect younger individuals. There have been documented cases such as that of Emma Schlamm, who was diagnosed with low-grade serous ovarian cancer at age 25. In this video, you'll learn the real causes of ovarian cancer and how to spot the warning signs early before it becomes dangerous. Take note, this video is not to scare, but to inform. Share this video with your mom, sister, or friend, because this kind of awareness could be life-saving. Let's dive into the causes of ovarian cancer quickly. Now, what causes ovarian cancer? There isn't just one cause, but doctors have identified key risk factors including age, family history and genes, never being pregnant, hormone therapy after menopause, obesity, and endometriosis. A condition where uterine-like tissue grows outside the uterus has also been linked to ovarian cancer. Now let's proceed to the signs. These symptoms may seem common, but what makes them different is their persistence, frequency, and how unusual they are for your body. Research shows that women diagnosed with ovarian cancer often had these symptoms for weeks or months before they were taken seriously. 1. Persistent bloating. Normal. Bloating after a heavy meal or around your period. Ovarian cancer. Bloating that happens almost daily, lasts for weeks, and doesn't go away with changes in diet. Why this happens? Ovarian cancer causes a buildup of fluid in the abdomen or tumor growth, which leads to continuous bloating that doesn't go away with diet changes or time. If you feel bloated almost every day for more than 2 to 3 weeks and it feels different from your usual bloating, it's time to check with a doctor. 2. Pelvic or lower abdominal pain. Normal. Cramps before or during your period. Ovarian cancer, a dull, persistent ache in the lower abdomen or pelvis that lasts for weeks and doesn't follow a usual menstrual pattern. Why this happens? It can be caused by a growing mass or inflammation from cancer. Unlike menstrual cramps that come and go, ovarian cancer pain is usually dull, constant, and gets worse over time. If you feel pain that isn't tied to your cycle, doesn't improve with rest, and lasts more than a few weeks, especially if it's new, it should be checked out. 3. Feeling full quickly or difficulty eating. Normal. Feeling full after overeating or stress. Ovarian cancer, you get full after just a few bites even when you haven't eaten much. It becomes a regular pattern. Why this happens? This happens because tumors or fluid can press against the stomach, leaving less room for food. It may also slow down digestion. Women with ovarian cancer often say they lose their appetite or feel full after only a few bites. If you feel full very quickly during meals, and this happens repeatedly without any obvious cause like stress or sickness, don't ignore it. 4. Frequent or urgent need to urinate. Normal. Drinking a lot of fluids or caffeine. Ovarian cancer. You feel the urge to pee more often than usual, even without drinking more, and it continues for weeks. Why it happens? Ovarian tumors can press on the bladder, making you feel like you need to go more often. It's similar to a urinary tract infection, but without the burning or pain. If you feel a sudden new change in how often you urinate, especially if you didn't increase your fluid intake, it could be a red flag. Take note, it could also be a sign of diabetes. 5. Unexplained fatigue. Normal. Tiredness from lack of sleep or stress. Ovarian cancer. A deep, constant tiredness that doesn't improve with rest and gets worse over time. Why it happens? Cancer affects the body's energy levels in many ways. It can lead to inflammation, disrupt normal cell function, and make the body work harder to keep up. If the cancer is advanced, it may even cause anemia. If you feel tired all the time, even after getting enough sleep, and the fatigue doesn't go away, it's worth discussing with your doctor. 6. Back pain. Normal. Strain from sitting too long or poor posture. Ovarian cancer. Lower back pain that's new, persistent, and doesn't go away even with stretching or rest. Why it happens? As ovarian cancer grows, it can put pressure on the lower back, pelvis, or nerves, causing pain. This is especially concerning if it's new, doesn't get better, and is not caused by a physical strain. If you feel persistent lower back pain that's dull and won't go away with usual remedies like rest or stretching, it could be something serious. 7. Changes in bowel habits. Normal. Occasional constipation or diarrhea from diet changes. Ovarian cancer. New and ongoing changes in your bowel habits for no clear reason, such as frequent constipation that doesn't go away. Why it happens? Tumors pressing against the intestines can lead to constipation, diarrhea, or general digestive discomfort. This is often misdiagnosed as IBS or simple gut issues, especially in early stages. Watch out for ongoing changes in your bowel movements without diet changes, lasting more than a few weeks. Before we continue, if you found this video helpful, please give it a like, share to spread awareness, and subscribe for more health topics every week. 8. Menstrual irregularities or spotting. Normal. Slight changes during stress or hormonal shifts. Ovarian cancer, unusual bleeding between periods or after menopause, especially if it's new or persistent. Why it happens? Ovarian cancer can affect the balance of hormones or spread to nearby tissues. Any spotting between periods, bleeding after menopause, or heavier than usual bleeding is a warning sign, especially in postmenopausal women, where any bleeding is abnormal. If you experience bleeding that is unexpected, irregular, or not part of your normal cycle, it should always be checked. Remember, these symptoms don't automatically mean you have ovarian cancer, but when they're persistent, unusual, or new, they deserve attention. Doctors say if you experience 2 or more of these signs daily for 2 to 3 weeks or more, get it checked. A pelvic ultrasound, physical exam, or CA-125 blood test can help rule out or catch ovarian cancer early when it's most treatable.